This health advice is sponsored by WellMed, USMD, and the Healthcare Associates of Texas. Recent studies are showing that older adults are seeing more medical specialists than ever before and are twice as likely to see a specialist when compared to their primary care physician. Joining us now to break this down is Senior Medical Director at WellMed, Dr. Matthew McLaughlin. Welcome.
Thanks so much. I'm glad to be here.
Yes, absolutely. Okay, so is it a problem that people are seeing all of these specialists? You know, sometimes it's a good thing to see a specialist all the time, but what are we seeing in this issue?
Right. It isn't necessarily so much whether it's a problem for a patient to see a given specialist. It's whether or not that specialist then communicates effectively with your family doctor. The more specialists you see, the more complicated it gets to manage your medical care, and then that can affect the quality of the care you're receiving.
Okay, interesting. Talk about some of the common mistakes people make when actually choosing a specialist.
So probably the most common mistake we see is asking your family or friends for a recommendation instead of discussing that with your family physician. The percentage of appointments with primary care physicians is actually dropping as the number of those with specialists goes up. So communication between the different physicians on the team is critical. When that doesn't happen, you see medication errors, duplicated or unnecessary tests, and other issues occur, which drives up costs and decreases quality. Research has shown that when there is a primary care physician at the center of your healthcare team, it leads to better health outcomes and lower cost. And that's what we're doing at WellMed, USMD, and HCAT. So if the recommendation for a specialist does come from your primary care physician, then you know that they have good, timely communication with that specialist, that each member of the healthcare team has access to your full health picture and needs, and we can also make sure that the specialist is covered on your insurance plan.
Okay, so maybe if we feel like there's an issue, it's not the first sign that we need to go see a specialist, maybe check with the primary care doctor first. But when is the right time to actually go see a specialist?
Obviously, when you're managing chronic healthcare conditions, it definitely makes sense to probably have a specialist on the team. Also, if you've received a new diagnosis, that's a good time to consider adding a specialist. But most importantly, these are the questions that you should be asking your primary care doctor. That's the best way to ensure you get the coordinated, compassionate care that you need.
Always go back to a medical professional, right? Where can we go if we want more information on everything you talked about here today, doctor?
Absolutely. We'd ask that you visit our website, carewithresults.com, and you'll find more information like we've been discussing today.
Well, thank you so much, doctor, for talking about all of these amazing things today. If you all want to know more information on everything we talked about here today, we will have that linked up on our website as well at cw33.com. And thank you again to WellMed, USMD, and the Healthcare Associates of Texas for sponsoring this segment.